Hi friends, today we are going to solve an MCQ. Let me read the question. Which impression material is used to record primary impression of flabby ridges? So the options are agar, addition silicon, irreversible hydrocolloid and impression material. So the answer is irreversible hydrocolloid. Irreversible hydrocolloid is nothing but alginate. So alginate impression materials is used as a primary impression material to record a flabby ridge. Let's see how. Generally, flabby ridges provide a very poor support to the denture. Support means you have to understand that stability is sidewards stability of the denture. Let's consider this is a denture and then a mandibular denture. So this kind of movement is prevented by stability, whereas support is vertical force like masticatory forces. Those kind of forces have to be resisted by support. So the support feature is affected by the flabby ridge. So here one kind of good solution is removing the flabby ridge by means of surgical therapy, and then we are going to replace it with a denture over there. So it's going to be fine. We would get a good vestibular area for a good support. Vestibular area is the distance from the ridge, top of the ridge to the base of the sulcus is vestibular area. So that is going to be better. But in conventional impression making, what happens is in conventional impression technique it's going to be mucocompressive. So in mucocompressive impression technique we are going to give more force in all areas, and what's going to happen is we are going to compress the flabby tissue, so it will be contracted, and when we make the denture and when we place it over there, it's going to be contracted and it's going to come again. It's going to rebounds and it's going to dislodge the denture. So it's not a favorable procedure, whereas selective impression is the proper method of recording flabby ridges. So what happens is here we have to compress the other areas for a good support, primary support, and the flabby ridges are exempted from pressurizing it. So here we have window technique or sectional impression technique. What happens is, let me show a diagram. Here you can see the diagram. So this kind of technique where here you can see a window, and here it is a two tray technique. So we are going to use two types of trays separately. Here you can see the patient suffering from having a flabby ridge over in the anterior region. Here you can see we have this in the anterior region, same spot. This is a desirable area. We are going to give a specific kind of relief over there, so the denture is going to be more supported. So we are going to have a hole in the area of interest, that is the flabby ridge area, and then we are going to make the impression where the first impression is going to be a mucostatic impression, and then we are going to use light body or impression plaster. That is, after you are taking an alginate impression in a primary impression, that is in a stock tray. Stock tray is nothing but it's a general tray used for various kind of patients, but it's not much of customization. So here we have, so here what happens is the alginate impression we take primarily and we pour a cast and we get a cast. Over there we are going to make a custom tray. In that custom tray we are going to give a window or a hole like opening for the specific area of interest, that is a flabby ridge area, and then we are going to use impression plaster, and then impression plaster or any kind of light body silicones, and then we are going to record the impression in the patient, and then it's going to be we are going to compress the region which is of no flabby ridge, and the flabby ridge area is going to be exempted from the compression. It's going to be under no pressure. I hope you understood the video. If you have any doubts, please leave in the comment section. Thank you.